Thank you very much. I bring you greetings from PAHO, and I wish to apologize for any delays occasioned by us in trying to negotiate the traffic here from PAHO headquarters in DC. It's indeed a pleasure to be here at Hopkins yet again. Now, the format of this presentation will look at the magnitude of the problem of road safety issues globally and at the regional level, review some of the mandates that we have. We'll share a little bit on interventions, and we'll speak to the GRSP project, which has already been mentioned by my colleague here. We'll do a quick overview of some of the published documents that we have at World Health Organization through PAHO, as well as some of the scientific articles. Some of my colleagues are here, and I wish to acknowledge Dr. Eugenia Rodriguez and Ms. Alessandra Sines, who are really our road safety experts in the organization. We'll speak to some of the challenges that are emerging and try to focus on some key recommendations. Good. Now, this gives you the global story of road traffic death rates per 100,000 population. The rates really are highest in Africa, 24.1 per 100,000, a little lower in the Eastern Mediterranean region. They're identical in Southeast Asia and the Western Pacific at 18.5 per 100,000 population. The Americas ranks at about number 5, with a road traffic death rate of about 16.1 per 100,000, and its lowest in Europe at 10.3. That really is, in one slide, the mortality rates globally. Now, there are differences in the distribution of road traffic deaths by cause and by region. Now, in the Americas, Europe, the Eastern Mediterranean, and Africa, as you can see in the yellow shading on the pie charts, the majority of deaths involve occupants of cars. Pedestrians are the second largest group of casualties in these 4 regions, while motorcyclists are the second leading cause of road traffic-associated fatalities in Southeast Asia and the Western Pacific region. Now, that's one story, but the other part of the coin is that overall, 50% of road traffic deaths occur in the so-called vulnerable groups. And these are pedestrians, who account for 22% of overall mortality, motorcyclists accounting for 23%, and bicyclists accounting for smaller rate at 5%. So 50% or so of road traffic deaths occur in pedestrians, motorcyclists, and bicyclists. Now, what we know about the overall story, which has been alluded to already, and I'm sure you get a lot more information during the course of today's seminar, is that the key risk factors are fairly consistent around the world. Alcohol, speed, and distractions while driving, which are particularly relevant in some of the more developed countries. So when you use your cell phone or try to text while driving, clearly put yourself at far greater risk. And of course, the protective factors, of which much evidence has come from some of the more significant studies which you again heard from just now, are seatbelt use of helmets in those who are cyclists, as well as child restraints. Now, road traffic injuries are now the 8th leading cause of death globally. These data are a little bit earlier, on the far right, to my far right, which links it at number 9. They're now number 8 in terms of ranking. And as you said earlier, about 1.24 million people die each year due to road traffic injuries. And each of these deaths is eminently preventable. In addition to the deaths, there are about 20 to 50 million injuries which are non-fatal as a result of road traffic crashes. The second column, which is to the left of the first one, really says that by 2030, should current trends continue, road traffic deaths will move from being the number 8th cause to the 5th leading cause of death globally. So this is a significant change that can be prevented by appropriate interventions. Now, there's a problem globally with limited data. Most countries rely on police data systems alone, and therefore it is very hard to see the significant work being done by our collaborating center at Johns Hopkins, which has really shed light in some areas in terms of data and information. And it's very hard to establish programs and interventions unless you have good evidence-based data. The other issue that one faces is that 50% of countries still use a 30-day definition of road traffic death. So if you've been injured and you die outside the 30-day period, you're not listed as a road fatality. Now, when you look at the prevalence of road traffic deaths by economic status according to regions, and the high-income countries are represented by the green, the yellow bar, middle-income countries, the low-income countries represented by the black column, the majority of road traffic deaths take place in low and middle-income countries. And that mimics much of what we see in the world in terms of non-communicable diseases and even communicable diseases. The vast majority takes place in low and middle-income countries, which actually have the largest populations in the world. Road traffic injuries are increasing in low and middle-income countries, and in some cases, the rates are twice those seen in high-income countries. And a lot of the issue seems to be the rapid rate of motorization in many of these developing regions. So therefore, overall, 80% or so of road traffic deaths take place in middle-income countries, 12% in low-income countries, and 8% in high-income countries. Whereas if one looks at the distribution of vehicles, 52% of vehicles are actually distributed into the middle-income countries, 1% in low-income countries, and 47% in high-income countries. So there's quite a mismatch. Now, the group that's particularly vulnerable to road traffic mortality are the young people. The second column highlights it in the green block. And really, road traffic mortality is the third leading cause of death in people aged 5 to 14. It's the principal cause in persons aged 15 to 29, and the third cause, again, in persons aged 30 to 44. As they get older, the road traffic mortality decreases. Now, let's move a little bit closer home to the Americas. As seen in this slide, road traffic injuries caused an estimated 150,000 deaths in 2010. The average death rate is about 16 per 100,000 population, and as I said before, pedestrians, motorcyclists, and bicyclists are the primary victims in all the subregions except in North America. Men at greater risk of dying than are women, and I think we all know why. There's, however, no correlation between the number of vehicles on the road, as said before, and road traffic deaths. Now, there's a variation in road traffic death rates, which ranges from a low of about 11 per 100,000 in North America to 22 per 100,000 in Latin America. Of particular significance, the Dominican Republic has the highest road traffic mortality in the region at 41.7 deaths per 100,000 population. This slide provides a more thorough breakdown of types of transportation and road traffic deaths by subregion in the Americas. The yellow part of the bars shows you mortality among pedestrians. And really it ranges from about 23 to 30% in the subregions, barring North America, where it's at the low of 12%. So the lowest mortality among pedestrians occurs in North America, the USA and Canada. The majority of deaths occur in occupants of vehicles, in other words, the red. And that's particularly significant in North America, where it accounts for 70% of road mortality. In the Caribbean, it's ranked at second with a mortality of 43%. High death rates among cyclists occur in Latin Caribbean, as I said before, the Dominican Republic, where it accounts for about 44% of mortality. And it really is because the mode of transportation is principally through motorcycles. The other thing which I'm going to draw your attention to is the gray part of the bars. Sorry, the blue part of the bars, which is unspecified cause of death. There's just a lot of missing information. Types of registered vehicles in regions of the Americas. Now, basically, the vast majority of vehicles, as I said before, seen in North America, which has 93% of four-wheel vehicles, followed by the Caribbean. So in other words, that's principal mode of transportation, where, as I said before again, the Latin Caribbean, almost half of registered vehicles are motorcycles, which correlates very closely with the motorcycle-related mortality. Now, if we look at registered vehicles compared to road traffic deaths in the Americas, it makes the point there's very little link. If you look at the tallest blue bar, that's North America. 66% of vehicles overall vehicles are registered there in North America. Mortality is only 28%. Whereas the mortality, the death rate in Southern Cone, as well as in Mesoamerica and the Andean subregion, it's far higher, whereas the actual vehicle registration is much lower. So there are differences in terms of what's happening. We're killing more pedestrians and cyclists, whereas there's a lower proportion of actual registered vehicles. Let's move on a little bit to the mandates that we face. In 2010, the United Nations General Assembly adopted Resolution 64/255, which proclaimed the Decade of Action for Road Safety, 2011 to 2020, with the goal of stabilizing and reducing the increasing trend in road traffic fatalities, with the hope of saving an estimated 5 million lives. And that really is the mandate that we follow globally. The Pan-American Health Organization itself in 2011 developed the Plan of Action on Road Safety 2012 to 2017, which comes out of the overall global mandates with, again, helping the member states to meet the goals of the Decade of Action. And that's what that's what underpins our agenda in the region. Now I'm going to share a little bit more detail based on what you've heard just now. You've heard about the 10 studies, the 10 countries involved in the Bloomberg Philanthropies funding. Relevant to our region is Brazil and Mexico. Now, the Pan-American Health Organization supports governments in addressing key risks. And the project in Brazil and Mexico both focus on drink driving. In Brazil, there's a focus on speeding. Mexico, there's a focus on improving the use of seatbelts and child restraints. And the activities were based on improving data quality, raising awareness using social media, training of the police, supporting NGOs, and monitoring and evaluating these results. Now, some of our achievements. The PAHO Brazil office collaborated with the Ministry of Health in conducting a road safety program known locally as Vida no Trânsito in 5 Brazilian capitals. The Ministry of Health later expanded this initiative to all other Brazilian capitals. As you heard earlier, the project is going to be completed in December of 2014. We weren't able to convince Bloomberg to continue the funding, but it has disseminated the PAHO WHO Plan of Action. It's led to evidence-based interventions. It's promoted multi-sectoral action for intervention, in other words, including law enforcement, with quite significant civil society participation. Now, this, of course, is key to the longer-term sustainability of the programs. Also, the PAHO Brazil office has worked to consolidate the health sector role in the traffic safety agenda. Regarding Mexico, these are some of the achievements. There have been legislative changes. In León, there's been municipal regulation. Seatbelts are now part of the law. Also, for children aged less than 12, it's now required that child restraint systems are used in vehicles. There's also been the implementation of random alcohol breath testing, though there have been challenges in making sure it is sustainably implemented. In Guadalajara, there's been a new mobility and transport law. So in other words, there are far stricter penalties after road traffic accidents. One can be detained by the legal forces for 36 hours without a right to bail, as well as there's been implementation of random alcohol breath testing. There's been a lot of engagement of NGOs. There's been tremendous social marketing on radio and television, and particularly at the target sites. The program has targeted the populations to increase awareness. There's also ongoing monitoring and evaluation and significant police training. And this dovetails with the social marketing. What is required for success in these programs? First and foremost, there must be very strong political engagement. There's been pretty significant leadership from WHO in building strong partnerships with a clear focus. There's been strong social marketing campaigns which have been very focused, and we dare say they've been hard-hitting, they've been evidence-based, and we've had a system of ongoing evaluation. There's been enforcement by trained staff using strategic plans and appropriate equipment. We've also focused on upgrading legislation, because unless the laws are in place, the measures will fall once the programs end. And as I said before, the role of NGOs and the media cannot be underestimated. Sustained funding from governments is also critical. And I think that's what we've tried to achieve, because when the programs or the short-term projects end, there must be established programs that will continue to do the work. Some of the challenges. The Bloomberg projects have had relative success in implementing an evidence-based traffic safety culture. However, the experience is limited to very few cities. And given the end of the funding from Bloomberg, there are concerns about sustainability. But we have raised the bar in that road safety will now be seen as a priority. In addition to the challenges, there are now opportunities. In particular, the Brazil program has contributed to an understanding of health transport issues beyond injury. So in other words, we now see that when one tries to retool mechanisms to reduce road crashes and injuries, one can actually pair this with improved health. So in other words, if you get populations to actually use public transportation, and I think for many of you, walking from the metro to your office actually has been the most exercise you've had for the day. So when one uses mass transportation, there's a necessary compulsion that one has to walk or run or do stairs in ways you don't do it otherwise. So in other words, one can combine the use of mass transit with being more physically active. Brazil will host the second global high-level conference on road safety. And this is an opportunity to increase the commitment to road traffic injury prevention and improve the importance of health in the transport traffic safety agenda. Now we come on to some of the published documents, and these will be available after for you. These are some publications, some of the Brazilian publications. And this pretty long list tells some of the work that we've done in the region. I'm afraid it's all in Spanish, but I'm sure that shouldn't be a problem here. And also in terms of some of the scientific papers, and some of these have been published by my colleague, Eugenia Rodriguez, among others, and I know she's working on some papers currently. Again, current information for the Americas. A challenge. And we spoke again about the fact that in Dominican Republic in particular, where motorcycles are the main mode of transportation, about 47% of the population, there's a problem in the Americas in that we are now seeing trends in fatal motorcycle injuries, which have been increasing since 1998, regrettably. So it is a continued growth in motorcycle injuries, particularly in younger people, age 15 to 24, and 25 to 34. So this is a particularly high-risk group that needs to be targeted for issues like wearing motorcycle helmets to reduce traumatic brain injuries and curtailing speed, among others. Some of the key recommendations based on knowledge in the region is that it would be appropriate to establish national advisory committees or lead agencies for road safety, providing them with the necessary authority and resources to promote road safety measures. So in other words, there must be mechanisms for coordinating approaches to road safety at the national level. It's also important to promote the development of policies and infrastructure which are conducive to safe transit for vulnerable road users. And as I said before, pedestrians, cyclists, and motorcyclists account for almost 50% of the mortality on urban roads and highways. So this is a particularly vulnerable group. So policies must take this group into consideration. One needs to reduce the contribution of risk factors, principally speed of vehicles and alcohol consumption, which promote road traffic injuries. And one must also increase the use of protective equipment, namely helmets for cyclists, seatbelt use and child restraints, by implementing and enforcing comprehensive laws on risk and protective factors. As I said before, improving mass transit systems will help to diminish the reliance on motor vehicle transportation, which reduces exposure to road traffic injuries and NCDs, as I said before, given the proven benefits of public transportation in increasing physical activity at the population level. One also needs to develop and/or strengthen surveillance systems to improve the quality of data. This is one of the big gaps that we still confront globally. We also need to promote enhanced technical safety requirements for new vehicles, including motorcycles. And of course, vehicles that don't meet safety requirements need to be removed from our roads. Promoting and improving road safety is improving and promoting social justice. And it has to be seen in that context. Thank you for your attention.